So the content of the presentation cover under the following heading. First, we will discuss about the introduction part, then dermatophyte taxonomy changes over a year, and understanding what are the understanding the keratin degradation, what are the causes of the dermatophytes, and what are the laboratory approach. So we will discuss the direct examination, histological examination, culture, biochemical, physiology test, and then what are the animal inoculation, what are the molecular diagnostic for the diagnosis of the dermatophytes, and what are the miscellaneous tests, and after that what are the key message from this presentation. So we know the dermatophyte are the keratinophilic fungi, the capable for the invading keratinous tissue. All the dermatophytes are the classified into the three groups. There is the epidermatophyton, trichophyton, and microsporum. And okay, my video is, ma'am, my video is coming.
Yes, it is visible.
Okay. So this is the dermatophyte taxonomy over the year. So you can see from 1842. So there was the first description of the dermatophyte based on the clinical picture. Then it is in the year of the 1816, there is the first description of the telomorph based on the environmental sample. In the year of the 1937, so there is the Latin diagnosis required the ICBN, and some names the invalid. And after that, in the year of the 1958, there is a type specimen required for the ICBN with the species description. And in the beginning of the 1961, there is the beginning of the mating and telomorph added to exist in the anaform. So in the year of the 2012, so you can see there is a pleomorphic nomenclature maintained by the ICBN. So you can see there is a how the trend are the changing. So in the overview of the changing taxonomy during the period of the 1840 to 2015, so you can see there is no original material has been preserved, and there is a rare one of the discarding as being doubtful. The widely use of the name as the neotype and the Latin diagnose were required for the between of the 1937 to 2013. So in the pleomorphic, the name with the separate, there is a formation of the ana and pleomorph has been relevant in the year of the 1957 and 2013. So in this, so you can see there is the maximum likelihood the phylogenetic tree. So generally in the maximum the phylogenetic tree based on the ITS region and the partial of the LUS. So these are the sequences of the trichosporons species. So using the GTR and GI as a model with the 1000 bootstrap application shows that the more than 70% of the microgypsum species was the selected as the outgroup. So so these are the species. So you can see. So there is the presentation. So in this, there is a number of the name changes of the member of the Arthrodermataceae during the period of the 1840 to 2012 within the 5-year increment. So you can see is a very good graph. So you can see there is a clinical plus culture, mating, and molecular basis. So you can see there is a number of the name of the changes of member of the Arthrodermataceae during the period. So the large number of the new name were created when the morphology was added to clinical data as the clinical criteria for the speciation, and the period of the there is a period of the 1960 and 1995 is a mark of the addition of the telomorphic name, and it is there leading to the dual nomenclature of the dermatophytes. So you can see there is a flow chart of the how the hard keratin degradation by the dermatophytes. So in the flow chart, you can see there is a bottom to neck in the process. So there is a secreted sulfide to reduce the sulfide bridges is the mandatory to complement the enzymatic activity, and the large peptide with the free end, which is the exoprotease, which act as the produced by the endoprotease. And you know there is a so there is a proline that cannot be bypassed by the non-specific aminopeptidase in the case of the proline-rich proteins, and there is a degradation of the protein chain into the amino acid, and short peptide is achieved by the complementary action of the propyl peptidase. So this is the flow chart of the hard keratin degradation of the dermatophyte. Now, when do you suspect the dermatophytes? It can be seasonal, and also depend upon the geographical, and it depends upon the patient population. It is present as a ring form lesions, look as a raising for the skin. Skin may be scaly, especially in the center. Hair loss may occur, and severe itching or the pain, the abnormal nail, yellow and white discoloration. So these are the loss of the nail. So these are the suspicion when you will suspect the dermatophyte infection. Now there is a table, it is given in the published recent publication. So there is a comorbidity and symptoms is there. In the case of the hepatitis C and liver cirrhosis, so there is a subcutaneous nodules is there. So in case of the HIV, so there is a atypical and multiple extensive lesion is there. So in case of the transplant and the chemotherapy patient, so nodules are there. So in the case of the history of the diabetic mellitus, there is the nodules in the anklet. So there is a use of the immunosuppressive drugs. So there is a fungal abscesses there. So fungal infection for that we are in the onchomycosis. So in case of the loss of the vision, so these are the case reports of the deep infection caused by the dermatophytes. Now, what are the type of the tineas? So in this table, you can see there is a tinea corpus. So there is a site of infection is the body like chest, face, arm, leg. There is tinea pedis is there. So there is a foot. Then is tinea capitis is there. There is the scalp. There is a tinea curis. There is a groin fold. So there is a tinea. There is this is the list of the tinea generally infect the different site of the infection, and these are the list of the dermatophyte which causes the infections. Now, how do you test of the dermatophyte? So determine if the antifungal has been used on the area. So it is a properly disinfect the area that you would like to take the sample. In the case of the hair, so hair follicle is there. In case of the skin, so leading edge of the lesion, and in case of the nail, so near nail bed is required. So it is the samples the place in the sterile container and submit to the lab for the identification. So this is the given the approach. How will you laboratory identify a dermatophyte? So first is a direct examination. So in second is you send the sample for the histological sample, culture, biochemical and physiological test, animal inoculation, molecular method, and some of the miscellaneous tests. So we will go in a detail one by one. Now, in the case of the direct examination, it is the essential. It is allowed to allow the clinician to start the treatment pending the culture. So fast, sometimes if the fast negative results reported 5 to 15% of the cases, and they depend upon the essential on the skill of the observation and the quality of the samples. So, and it is a highly efficient screening technique generally used. So yesterday there was the very detailed discussion on this direct examination. So so now there is a clearing agent. So in the clearing agent, generally there is a correct visualization of the fungal elements required the dissolution of the collecting material. So that these clearing agent allow to digest the keratin. So what are the clearing agents? So there is a 10 to 20% of the potassium hydroxide with and without dimethyl sulfoxide. There is called DMS. So it is the most commonly used. It is the simplest and cheapest, and it allows the immediate observation and particularly suitable for the nail. So these are the amine chloral lactophenol, which is also clearing without heating, and these are the very helpful for the direct examination and recommended for the examination and the conservation of the hair samples. So this is generally used. So the stain and fluorescent, it is already got, but we will take in the some of the names because we are taking the lecture on the dermatophyte. So there is a chlorophyll black E, the stain for the fungal structure and exhibits for the many artifacts. So these are the most useful for the yeast, then the mold, and there is a blue black ink. So that is called the purple pink, which stain the fungal element in deep blue. There is a pass, which is the stain the polysaccharides such as the glucosamine glucosa aminoglycan, so can be adopted to direct examination of epidermal scale. And calcofluor white, it is the most convenient fluorochrome, allow the rapid and accurate diagnosis of the dermatovites infections. And there are commercially available the dyes. They are the very helpful for the staining of the fungal element for the direct microscopy examination. There is a CSS, there is a cyanoacryl surface skin scraping. This is another diagnostic tool, and this method is removed to the sheet of uniform thickness of the stratum and corneal for the direct examination by the pressing firm onto the lesion. In the case of the there is the sheet, it is required for the recovery with the cyanoacryl adhesive. So these are the methods generally used. So you can see the picture. There is a fluorescent detection of the fungal hyphae. So there is a direct detection infective scales in there. So you can visualize under the phase contrast microscopy. Now come on the culture. There is a culture is valuable, and there is the obligate to complement to the direct examination, and there is a isolation of the pathogen by the culture by itself at the species level, which cannot be reached by the direct examination and the histopathology. And it is also important since the prophylaxis and therapeutic may vary depend upon the species. Now there is a isolation of the dermatophyte. There is the SDA containing the antibiotic chlorophenol, and there is a gentamicin and chlorhexidine. Actinion is a commonly used for the primary isolation medium. There is an incorporation of the cyclohexamide in the medium, which prevent the growth of the majority of the mold, and which it also some of the yeast that could not hamper the recovery of the dermatophytes. So there is a DTM medium is there. There is dermatophyte test medium. It is also alternative for the isolation, and there is a DTM is a very effective and convenient method to confirm the diagnosis of the dermatophyte infection in the patient with the sign of the onychomycosis. There is a CDSAM. There is a combination. There is a D activators supplement agar medium. It is also very helpful in the recovery of the dermatophytes. So another, there is a rapid sporulating medium is there. This turn yellow to shade of the blue green in the presence of the dermatophyte. It enhances the sporulation. Is also there is a one of the advantage in this. And there is a BCP. There is a casein yeast agar. There is also help in the rapid identification of the T evolution in the specimen from the rural area. So these are the media generally used. Now come on the identification of the medium. There is the identification of the medium. Generally, BLA, there is broadly lactimeral agar, there is a potato dextrose agar are the most widely used. And there is a one of the, there is a Falcon yeast extract agar PYE, their supplement with the antibiotic to the inhibit the growth of the bacteria in the nutritionally rich medium that is support to the luxurious growth for the most of the fungi. There is a BCP milk solid glucose agar. It is a generally used in some of the research laboratories. And in this, there is a medium, there is a turn from sky blue origin color to the violet within the to 7 days in the presence of the T mentocrophride, and this permitting the differentiate between the T rubrum and T periscolor. So these are the important medium generally used for the also used in identification as well differentiation of the species. Now come on the brain heart effusion graph. So this is the also stimulate the growth of the T vasculum. So as the blood media, and therefore may be used in the case of the tinea corpus in the rural area. And there is a BCP milk. So this is the again used in the some of the laboratories, and it is already we have discussed. It is a repeat here. So you can see there is a dermatophyte, there is a different samples, there is a hair, nail, skin, there is a hair and skin, there is a nail and skin. So you can see there is a group of the trichophyton, there is a microsporum, there is a epidermatophyton is there. So you can see there is a micro and macroconidia is there, T rubrum is there. So in case of the no microconidia and no macro is there, so it is T valisum. In the case of the macroconidia, so there is a macroconidia in this. So these are the differentiation of the dermatophytes, and there is a presentation of the macroconidia in the species we will discuss in a detail in the next slides. So how to colony characterize? So in the colony characterize the pigmentation on the surface and the reversal on the SDA is important. There is a texture is also important. In the textures, you will see there is a cottony, woolly, velvety, powdery, and sometimes they're granular. So these type of the presentation generally seen on the texture or the surface. And topography, there is the elevation, margins, and the folding. So these are the very helpful the observation in the identification of the dermatophytes. So generally the most important SDA is the one most of the important media generally used for the identification of the dermatophytes. Now you can see there is a characterization of the macroconidia and the dermatophytes. So there is a microscopic examination is very important there. In this microscopy, generally you will see the appearance and arrangement of the macroconidia and microconidia in the identification of the dermatophytes. And you will also see the see the characterization of the macroconidia. There is a size, shape, number, septation, and characters of their walls that are the very important in the identification of the dermatophytes. So in this, you can see there is a microsporum canis, there is a microsporum gypsum. So in this, there is a list of the dermatophytes. So you can see there is a macroscopic presentation. So you can see there in the canis, so there is a knob, it is there. There is a spiny with the rough and thick wall, and you can also on the reversal on the SDA, so you see the yellow and dull to brown with the age. In case of the gypsum, so you will see there is a spiny and thin wall with the 3 to 6 cell rounded with the cell. So in case of nanunum, so there is a many of the oval in the shape and thick and spiny. So these are the presentations of the dermatophytes. So these are the some of the very identical. So on the basis of the morphological character, so you can easily identify the dermatophyte under the microscope. Now this is the again some of the dermatophytes. There is given the in case of the tree rubrum, there is a 2 to 8 parallel slide, and there is a presentations, and you can also see on the SDA. So there is a deep red and some wine, and sometimes there is a brownish and yellow colorless type of the things are there. So these are the important one. And in case of the in case of the there is a generally it will take the time. So you can see there is a time duration is also given. So there is it will take 10 to 12 days taken. So in the case of the mentagrophytes, so you can see there is a cigar shape. Some of the dermatophytes, they are the identical morphological characters. So on the basis like a cigar shape, you can easily identify this is the there is a T Mentagrophyte is there, and sometimes so you can see there is a arrangement. There is a spiral shape of the hyphae is there. So these and it will take 7 to 10 days. So these are the very helpful in the identification of the dermatophyte. Now come on there is a very good research paper. There is a overall the update of the laboratory diagnosis of dermatophytes. There is a very good table is there. So you can see in this sorry. So in this, the direct microscopy and culture from the skin, hair, and nail sample. So you can see in case of the study was by the et al. Prakash et al. So in this, there is a skin and hair sample is there, and there is the positivity in the culture is 55.8%. In the study, there is a nail. So you can see there is a positivity by the culture is 74%. So in the case of the skin and the nail, so they use these type of the direct microscopy examination, and they found the around culture positivity is 27%, and there is a sensitivity of the direct microscopy is in case of the Parker stain is a 63. In the case of the calciferol is a 91%, and in case of the Chicago blue is 75%. So this is the very good table. So you can understand the samples, what are the sensitivity, specificity in the under the microscopy, and what are the positivity under the culture. Now this is again, so you can see there is a sample is nail, and there is performed the direct examination by the KUH and pass and calcofluor. So there is the they use the medium for the cultivation as a SDA, and they got the positivity is around 26%. So this is the very good paper. So there is the information regarding the how will you compare the direct microscopy and culture on the depend upon the samples. Now come on the some of the biochemical and physiological tests, which are the very helpful in the identification. So in the case of the dermatophytes, they are also able to hydrolyze the high concentration of the urea. So in the case of the it is very helpful to differentiate the T rubrum and T mentagrophyte. So in the case of the T rubrum, there is a urease negative, and T mentagrophyte so it is a urease positive. So in case of the next another test is the in vitro hair perforation test. So there is a dermatophyte, they are able to penetrate and invade the hair shaft by the producing of the specialized performing organ, where the other species attack the hair by the simple peripheral erosion. So you can see this is the picture. So there is a in vitro hair perforation test some of the laboratories are using currently. And next important is the mating test. It is also allowed to differentiate the species of the M. gypsum and the Microsporum fulvescens. So and as well as T. mentagrophytes for in this mating generally what is the procedure? There is a procedure is there is a Takisho medium is there. So it is generally used for the mating. There is a small amount of the mycelium picked from the potato dextrose agar and implant into the mating medium about 2 centimeters of distance to each other, and the plate kept at the 27 Celsius for 6 weeks at the time. So many there is sponta formations around the cottony T. rubrum colony. So you can see in this picture. So there is some other vitamin and supplements are very helpful. So there is a nutrient nutrition requirement for the determination by the comparing the growth on the control mediums. So some of the vitamins and some of the amino acids are very helpful. So these are the in case of the there is a nutrient supplements. They are the very helpful to enrich the medium, and some of the dermatophytes, they are easily grow. So this is the like the nicotine acid, there is histidines. So these are the vitamins and nutrition are the very helpful for the growth of the dermatophytes. So in case of the animal inoculation, so there is a few experiment. They are infected the guinea pig and the rabbit are still are needed for the antifungal accessibility testing to study the what are the pathogenesis of the dermatophytes. And there is no more use for the routine identification of dermatophytes, and this is the only particularly to the difficulty to obtain the animal without previous contact with dermatophytes, and the development of the more browsing method, including the molecular method. Now come on the molecular method. So there is a PCR, RFLP, and sequencing ITS regions are developed, and most of the molecular approach are used in the research laboratories, and some of the reference laboratory used as a tool for the identification of the newer species also. So DNA of the dermatophyte can also detect the directly from the clinical samples, and some of the PCR ELISA based kits or using the dermatophyte species probe are the also commercialized kits are available. So in this, there is a list of the methods are there. There is an advantage and disadvantage. So in case of the conventional PCR, it is a better cost-effective ratio, and it is a help in the rapid detection of the dermatophytes. Only there is a post-PCR test might be necessary to complement the diagnosis. In case there is a nested PCR is also used, it is a very good sensitivity. So, but there is a high risk of the contamination. So in the case of the multiplex PCR, you can multiple target can be used in the same reaction. It will help in the time saving, and it also used as a rapid diagnostic. And sometimes there is a probability of the non-specific binding between the primer. So PCR, RFLP, there is a low cost and does not require the sophisticated equipment. So use of the restriction enzyme is a necessary requirement for the more time for the diagnostic analysis, and not commonly used in the case of the diagnosis, only the research purpose. In the case of the real-time PCR, and there is a low risk of the contamination, but the post PCR are for the rapid identification and quantification. So specific equipment and the high cost than the conventional PCR. Now the very popular method nowadays, it is a multi-top. There is the identification organism as the genus, species, and strain level are possible. Only sometimes the difficulties in the access of the incomplete information, and sometimes the dermatophyte species database is database used for the identification, and sister species may be in existence because of the similar molecular component. So this is the only the disadvantage, but nowadays generally identification will very helpful by the multi. And there is a paper is published in the overview and update for on the laboratory diagnosis of the dermatophytes. So in this you can see what are the molecular methods used in case of the real-time PCR. There is a, in case of the direct microscopy, there was the detection was the only the 10 around 10%, and the culture was the 15, and by the help of the molecular method it goes to the 15%. In the case of the multiplex PCR, you can see the culture that is identified 90%, but by the help of the molecular method ITS region target, it very helpful in the identification. It gives the 100% detection. So in the case of the like there is a another multiplex PCR, there is a chitin synthetase, there is a target, and they are easily identified, the T rubrum, T mentogrophyte, the kinase. So in the direct microscopy, only the 59% detection is there. In the culture is 65, but by the help of the molecular techniques, so it is a 65.6%. So in the case of the multiplex, another multiplex is there. So there is a culture only identify only 12% of the cases, but by the help of this method, 31.6% of the molecular technique help in the detection. So this is the very good chart. So you can see what are the methods, what are the target, what are the organisms, and compare between the direct microscopy culture and the percentage of the molecular techniques. So again, this is the same thing. And now come on the MALDI-TOF. So MALDI-TOF, it is a processing technique for the identification of the microorganism in the fingerprinting of the protein extract from the there is a MALDI-TOF, and it is a very helpful the characterization and fingerprint of the protein to identify the specific microorganism by the combination of the species specific pattern includes in the reference spectral library. The only the concern associated with the identification of the pathogenic fungi by the MALDI-TOF, there is a similarities of the molecular component which can render the sister species in distinguish. For the example like T. rubrum and there is Microsporum canis and T. volusum. So these are the some of the concern in the MALDI-TOF. Now some of the miscellaneous tests like there is a Fourier transform, intra red spectroscopy, there is a FTIRS. It is also help in the diagnosis of the dermatophytes using the clinical isolates generally used in the Central Europe, and this also help in the species identification of the volatile organic compounds profiling, gas chromatography, mass spectrophotometry. So these are also potential tool for the species identification in the dermatophytes. Some of the limitation is also there. So it is the overall key message from this presentation. The mycological analysis is required for the diagnosis of the dermatophytes infection. So the conventional methods and technician and biologist, they may encounter some difficulties, and always keep in the mind that the quality of the clinical specimen is essential for the accurate diagnosis and contribute to the species identification is rather limited, and progress is still needed for the development of the biochemical and immunological tests, allowing as well as accurate identification as species level and depending for the availability of the molecular biological base kits. And one thing is also very important, the case of scenario of the MALDI. So there is the establishment of the extensive online database containing the molecular profile of the fungal species involvement in the human disease. There is a possibility of the inclusion of additional information by the user would be major advances in this field. And it is also development of the reliable algorithm and allow to rapid consideration of the thousand of the reference molecular profiles. They can easily assessed by the everyone. So these all the things will be very helpful in the identification of the dermatophytes. So thank you for the listening.